Many men start experiencing difficulty urinating, waking up multiple times every night to use the bathroom, and feeling like their bladder never completely empties no matter how long they stand there trying. These symptoms gradually chip away at their quality of life, their sleep, their confidence, and their sense of control over their own body. What makes this even more frustrating is that most men believe these problems are simply an inevitable part of getting older, something they just have to accept and live with for the rest of their lives. Here is what very few men understand, and what I wish every man over 40 knew. These symptoms are not inevitable with age, and your prostate does not have to enlarge and cause problems just because you are getting older. Your prostate can age in a healthy way without causing urinary symptoms, without disrupting your sleep, and without diminishing your quality of life. The difference between men who develop significant prostate problems and men who maintain healthy prostate function well into their 70s and 80s comes down to specific preventable factors that you have far more control over than you might think. Today I am going to show you, from my perspective as a urologist who works with men dealing with prostate issues every single day, the best strategies based on solid scientific evidence for preventing prostate enlargement before it becomes a problem. These are not complicated interventions or expensive treatments. These are straightforward lifestyle modifications that address the root causes of prostate growth and give your body what it needs to keep your prostate healthy as you age. My name is Dr. Isabel Lopez, and I am a urologist who specializes in helping men understand how small, consistent changes in their daily habits can protect their prostate and preserve their quality of life for decades to come. I want to know where you are watching from today. Drop your city or country in the comments below. And make sure to follow this channel because I am dedicated to giving you practical evidence-based guidance that actually works. The strategies I am about to share can make the difference between enjoying your later years with full vitality or struggling with progressively worsening symptoms that limit your freedom and comfort. Before we talk about prevention strategies, you need to understand what benign prostatic hyperplasia actually is and why it happens, because this knowledge is the foundation for everything else. BPH is the medical term for non-cancerous enlargement of the prostate gland, and it occurs primarily in men over 50 years old. As you age, hormonal changes in your body, particularly shifts in testosterone and estrogen balance, trigger cellular growth in the prostate tissue. This growth gradually increases the size of the gland, and because the prostate surrounds the urethra, that enlargement creates pressure and obstruction that leads to urinary symptoms. The growth of the prostate in BPH is influenced by three major factors that all work together. The first is hormonal changes, specifically the conversion of testosterone into a more potent form called DHT, which directly stimulates prostate cell growth. The second is chronic inflammation, which damages tissue and triggers abnormal cellular responses that promote enlargement. The third is metabolic dysfunction, particularly insulin resistance and elevated blood sugar, which creates a pro-growth environment throughout your body, including in your prostate. Understanding these three drivers is critical because each of the prevention strategies I am about to share targets one or more of these mechanisms. The symptoms of BPH develop gradually over months and years as the prostate continues to enlarge. You might notice that your urine stream is weaker than it used to be, that you have to wait longer for urination to start, that you feel like you cannot completely empty your bladder, or that you are waking up multiple times at night to urinate. These symptoms are not just annoying. They indicate that your prostate is compressing your urethra and interfering with normal bladder function, and if left unaddressed, they tend to worsen progressively over time. The key insight that changes everything about how you approach this is recognizing that BPH is not inevitable and it is largely preventable. The factors that drive prostate growth, hormonal imbalance, chronic inflammation, and metabolic dysfunction are all modifiable through lifestyle choices. When you address these root causes proactively before symptoms develop or when they are still mild, you can slow or even stop prostate enlargement and maintain normal urinary function throughout your life. This is not wishful thinking. This is what the research and clinical experience consistently demonstrate when men implement these strategies seriously and consistently. The first and most powerful prevention strategy is adopting an anti-inflammatory diet that directly addresses one of the primary drivers of prostate enlargement. Prioritize foods that are rich in lycopene, which is found in cooked tomatoes, tomato sauce, and tomato paste. Lycopene is a powerful antioxidant that has been proven in multiple studies to reduce prostate cell growth and lower the risk of both BPH and prostate cancer. The cooking process actually increases the bioavailability of lycopene, so pasta with marinara sauce or homemade tomato soup are excellent choices for prostate health. Stick with me until the end because I am going to give you a complete practical action plan that ties all 4 strategies together into a daily routine you can start implementing immediately. But first you need to understand why omega-3 fatty acids from fatty fish like salmon, mackerel, sardines, and anchovies are so critical for prostate health. Omega-3s are potent anti-inflammatory compounds that reduce the production of inflammatory molecules throughout your body, including in prostate tissue. They also help balance the omega-6 to omega-3 ratio, which is often severely skewed toward inflammation in modern diets. Aim for 2 to 3 servings of fatty fish per week to get adequate omega-3 intake. Include plenty of colorful fruits and vegetables, particularly berries, which are packed with antioxidants that combat oxidative stress and protect your cells from damage. Oxidative stress is one of the mechanisms that promotes abnormal prostate growth, and antioxidants from whole foods neutralize the free radicals that cause this damage. Blueberries, strawberries, blackberries, and raspberries are all excellent choices that you can add to yogurt, oatmeal, or eat as snacks throughout the day. Equally important as what you add to your diet is what you eliminate or drastically reduce. Avoid ultra-processed foods, which are loaded with inflammatory additives, preservatives, and unhealthy fats. Minimize your intake of added sugars from sodas, candy, and baked goods, because excess sugar drives insulin resistance and creates a metabolic environment that favors prostate growth. Eliminate trans fats completely, which means avoiding fried foods, margarine, and commercially baked goods. These dietary changes reduce systemic inflammation, improve your hormonal balance, and create conditions where your prostate is far less likely to enlarge abnormally. The second critical prevention strategy is controlling your body weight and specifically reducing abdominal obesity, because excess fat around your midsection has a direct and powerful impact on your hormonal balance and prostate health. Abdominal fat is not just passive storage of excess calories. It is metabolically active tissue that produces inflammatory compounds and contains high concentrations of an enzyme called aromatase, which converts testosterone into estrogen. When you carry significant belly fat, your estrogen levels rise and your testosterone levels decline, creating precisely the hormonal imbalance that drives prostate enlargement. This hormonal disruption accelerates the growth of prostate tissue and worsens urinary symptoms in multiple ways. Higher estrogen levels stimulate prostate cell growth directly. Lower testosterone levels reduce your overall vitality and muscle mass, which further contributes to metabolic dysfunction. The chronic inflammation produced by abdominal fat circulates throughout your body and concentrates in tissues like your prostate, creating the perfect environment for abnormal cellular growth. All of these factors work together synergistically to increase your risk of developing symptomatic BPH. The good news is that you do not need to achieve some perfect ideal body weight to see significant benefits. Research shows that losing just 5 to 10% of your current body weight, if you are overweight, can dramatically improve your metabolic health, reduce inflammation, and restore better hormonal balance. For a man who weighs 200 pounds, that means losing 10 to 20 pounds, which is an achievable and sustainable goal when approached gradually over several months with consistent dietary changes and increased physical activity. The most effective approach combines the anti-inflammatory diet I described in Strategy 1 with regular physical activity, which I will discuss in Strategy 4. Focus on reducing your waist circumference specifically, not just your overall weight, because visceral fat around your organs is the most metabolically harmful type. Measure your waist at the level of your belly button and aim to get it below 40 inches if you are currently above that threshold. Track your progress monthly rather than obsessing over daily fluctuations, and celebrate the improvements in how you feel, including better energy, improved sleep, and reduced urinary symptoms, not just the number on the scale. Before we dive in, I want to share something special with you. I have created a 21-day challenge designed to help reduce and prevent prostate enlargement with simple exercises you can do in less than 15 minutes a day. Do not wait. Grab your copy of the ebook right now. The link is pinned at the very top of the comments. The third prevention strategy addresses the beverages you consume daily, because certain drinks directly irritate prostate tissue and worsen urinary symptoms even if they do not necessarily cause prostate enlargement themselves. Coffee, alcohol, and carbonated soft drinks are the three main categories that deserve your attention. Excessive caffeine from coffee and energy drinks acts as a bladder stimulant, increasing urinary frequency and urgency. Caffeine also has diuretic properties, which means it increases urine production and can lead to dehydration if you do not compensate with adequate water intake. Alcohol places a heavy burden on your liver, which is responsible for metabolizing and clearing hormones including testosterone and estrogen. When your liver is overworked processing alcohol, it cannot efficiently maintain hormonal balance, and you end up with elevated estrogen levels that promote prostate growth. Alcohol also acts as a direct bladder irritant, making you feel the need to urinate more frequently even when your bladder is not actually full. Regular or heavy alcohol consumption significantly worsens urinary symptoms in men with BPH and contributes to the hormonal imbalance that drives prostate enlargement. Carbonated soft drinks, whether regular or diet versions, create gas and pressure in your digestive system that can put additional pressure on your bladder and prostate. The carbonation itself irritates the bladder lining, and if the drinks contain caffeine or artificial sweeteners, those add additional layers of irritation. Regular sodas also deliver massive amounts of sugar that drive insulin resistance and metabolic dysfunction, which indirectly affects prostate health through the mechanisms we discussed earlier. The solution is to replace these irritating beverages with healthier alternatives that support rather than undermine your prostate health. Water should be your primary beverage throughout the day, aiming for adequate hydration without overloading your bladder in the evening hours before bed. Green tea in moderation, meaning 1 to 2 cups per day, provides beneficial antioxidants including compounds that may help reduce prostate growth, but avoid consuming it late in the day due to its caffeine content. Fresh vegetable juices and fruit smoothies made without added sugar can provide nutrients and hydration, but consume them in reasonable portions to avoid excessive natural sugar intake. The fourth and final prevention strategy combines regular physical activity with smart urinary habits, both of which directly impact prostate health through improved circulation and reduced congestion. A sedentary lifestyle where you sit for most of the day reduces blood flow to your pelvic region, which means your prostate receives less oxygen and nutrients and has more difficulty clearing waste products and inflammatory compounds. This pelvic congestion creates an environment where prostate tissue is more likely to become inflamed and enlarged over time. Walking daily for at least 30 minutes is one of the simplest and most effective forms of exercise for prostate health. Walking improves circulation throughout your entire body, including your pelvis, helps maintain healthy body weight, reduces stress, and supports better hormonal balance. You do not need intense workouts or complicated exercise programs. Consistent moderate activity like brisk walking, swimming, or cycling provides tremendous benefits. Additionally, incorporating gentle stretching of your hip flexors, lower back, and pelvic floor muscles improves flexibility and circulation in the prostate region specifically. Beyond general physical activity, specific urinary habits can make a significant difference in preventing prostate problems. Never hold your urine for extended periods when you feel the urge to go, because chronically overfilling your bladder weakens the bladder muscle and increases pressure on your prostate. Take your time when urinating and make sure you completely empty your bladder rather than rushing through the process. Sit down to urinate occasionally, especially if you are having difficulty starting your stream, because this position relaxes your pelvic floor muscles and allows for more complete emptying. Practice good bathroom timing by urinating before bed and avoiding large fluid intake in the 2 to 3 hours before sleep. This simple habit can dramatically reduce nighttime waking and improve your sleep quality, which in turn supports better hormonal balance and overall health. Pay attention to your body's signals and establish a regular bathroom routine that prevents both holding urine too long and going unnecessarily frequently out of habit or anxiety. These habits, combined with regular physical activity, maintain healthy pelvic circulation and bladder function that protect your prostate as you age. Join the Members Club. Drop a super like if this video has given you a clear, actionable plan for protecting your prostate health. And share this information with any man over 40 who needs to understand that prostate problems are not inevitable. Let me bring everything together with the central message that should guide all of your decisions about prostate health moving forward. Preventing prostate enlargement is absolutely possible, and it depends entirely on consistency and care in 4 key areas of your life. What you eat has a direct impact on inflammation and hormonal balance in your body. An anti-inflammatory diet rich in lycopene, omega-3 fatty acids, and antioxidants while minimizing processed foods, excess sugar, and unhealthy fats creates the nutritional foundation for a healthy prostate. Your body weight, and particularly your abdominal fat, directly influence your hormone levels, with excess belly fat driving the estrogen dominance that promotes prostate growth. Losing even modest amounts of weight can restore better hormonal balance and reduce inflammation throughout your system. The beverages you drink either support or undermine your prostate health. Excessive caffeine, alcohol, and carbonated drinks irritate your bladder and prostate, disrupt hormonal balance, and worsen urinary symptoms. Replacing these with water, moderate green tea, and fresh juices supports hydration and provides beneficial nutrients without the irritating effects. Your physical activity level and urinary habits determine circulation to your prostate and the health of your bladder function. Regular movement and smart bathroom habits prevent congestion, maintain strong bladder muscles, and support optimal prostate function. Taking care of your prostate is not just about avoiding uncomfortable urinary symptoms. It is about preserving your longevity, maintaining your energy and vitality, and protecting your quality of life as you age. Prevention is always the best treatment, and the time to start is right now, regardless of whether you currently have symptoms or not. The strategies I have shared today are proven, practical, and powerful when implemented consistently. Make these changes part of your daily routine, and you will give yourself the best possible chance of maintaining a healthy prostate and enjoying life to the fullest for decades to come.